Okay, so I'm Joanna Vasquez. I'll be doing my CHECKOFF1 today, and here I have my roommate and my classmate, Rylan Delines. Do you give consent to do this?
Yes.
Alright, perfect. So I'll get started now. I do have my materials before we get started. I have hand sanitizer, my stethoscope, and it has been cleaned. In a real life setting, I would have the pen light, and I would have any other things that I would need to assess the patient's lungs. Okay, so I'm going to walk into the patient's room now. Knock, knock, knock. May I come in? Hi, my name is Joanna Vasquez. I'll be your student nurse today. Today we're going to go over three systems. So I'm going to provide you some privacy. This is my invisible curtain. Okay, so now we're going to be identifying some of her landmarks. This right here is like a little dent between her clavicle. That's her suprasternal notch. And then here is her clavicle. So right down the middle is the mid-clavicular line. If I go 2 ribs down, and then scoot over towards her mid-sagittal line, that's her ankle oblique. And so this right here is her axillary line. So this is her mid. It would follow along down the side of her body in the middle, and then this is her anterior and her posterior. Thank you. And so then we're going to turn her around. So these are her scapulas. So down the middle is her scapular line, and then down the middle, following her spine, is her vertebrae. So the right has 3 lobes, and the left has 2. However, on the back, when you're listening, you're only going to assess the 2 lobes on each side. It's easier to assess the 3rd lobe on the right side when you're assessing the anterior position or the anterior side of the patient. So the physician's not having any difficulty breathing, so when I'm assessing the patient, I should find everything accordingly. So right now I'm going to do this on the patient's back. It's aligned with the middle, and I'm going to ask her to take a big deep breath. Okay, so my fingers did move along with the patient, so that's exactly that's what we're looking for in this assessment. That was a 45-degree angle. On the front side, on the anterior, we're going to look for a 90-degree angle. So I'm going to turn the patient around one more time. So right here, a little close. All right, so if the patient can take a big deep breath from me again. So you can see right here, my fingers kind of go up and then back down. That was the 90-degree angle. So in a moment, I'm going to have you take a few deep breaths, okay? Her breaths weren't labored, she wasn't having any difficulty breathing. Once again, her lung sounds were nice and clear. Alright, perfect. So the sons weren't changed in any way. They weren't muffled, and I did not hear any wheezing. Her lungs were nice and clear. 99, 99, 99, 99, 99, 99, 99, 99, 99, 99. Right now I'm going to have her say the letters E, E, and I'm going to listen to see if I should not hear anything else besides the letters E, E. If there's a difference in sound from what she's saying, then that means that there could be an issue with her respiration or with her lungs. So now we're going to say E, E, okay? Go ahead. E, 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 E. So listen to the patient's lungs as she takes some deep breaths. If you feel any lightheadedness or dizziness, just let me know. We'll slow down and we'll take it from there, okay? vascular assessment. I am looking at the patient's neck. I'm making sure that her neck muscles aren't distended. I'm also looking at her carotid. In just a moment, I'm going to assess her carotid with my stethoscope. But it does not look like it's distended. There's no issues. I know that she's getting her blood flow. She doesn't seem like she's dizzy or anything. So I'm going to go ahead and get my stethoscope right now. Hear it and everything. Alright, so now we're going to move on to her other pulses. So I was listening to her apical pulse too. Her apical pulse, if I measured it, it would be her midclavicular line and then five intercostal or ribs down. So it'd be right about here. Yeah, right there. And it's nice and strong. It's a good, steady, normal pulse. The rhythm is great and everything. So now I'm going to go ahead and listen to the different parts of her heart. So here we have the aortic. Her pulmonic. Tricuspid, and her mitral. Okay, so now I'm gonna go ahead and assess her arms and her legs. Her skin is nice and pink. She's not too pale. She's warm to touch. She's not too cold. I'm going to check her other pulses, so it's her radial. Once again, nice and strong pulse. Her ulnar. This side. If I went ahead and checked them, they should be at the same pace. And so now I'm going to perform, is it the Allen's test? Okay, so now I'm going to perform the Allen's test where I hold both of her pulses on one arm. I'm going to have her pump her arm, or her hand, and then in a moment I'm going to release one at a time, and I'm going to look at the blood flow returning back to her hand. Go ahead. Stop. As it did, nice and pink blood flow going through her hands. Now I'm gonna check for turgor. I'm checking for turgor in her hand just to make sure that she's properly hydrated. What I'm making sure is that her skin retracts back in place. Now I'm gonna check. Okay, so now on her hands, I'm gonna go ahead and check her capillary refill. On her nail beds, it should be less than 3 seconds. I'll show her hands. I'm actually checking for any improper hair growth. Everything looks great on both sides. So bilaterally, everything looks great. There aren't any lesions on her skin. And so now I'm going to look for her brachial pulse. And then again on this side. Alright, looks good. So I'm going to move on to her legs. I also don't see, I see some bruising, but nothing to be worried about. She has some birthmarks, but nothing abnormal. There's no abnormal hair growth, no lesions, and so her capillary refill looks great. Now I'm going to assess her popliteal pulse on the back of her knees. On this side. And then the rest of her pulse. This will be her pedal pulse. I actually feel it right here. And then muscles behind her foot, or her ankle. All right, her capillary flow looks great, so she's a nice and healthy patient. This will conclude the rest of my assessment. Thank you.